think the very beginning, all of this occurred in about eighth grade. I distinctly remember going to my sister's basketball game. My grandma had offered me a piece of candy for being willing to attend my sister's basketball game, which I didn't think was necessary, but I mean, who's going to turn down candy? And then the following day, my vision has started to go blurry. I couldn't really tell what it was, and I was just getting so internally frustrated. I just couldn't comprehend why this was happening. So yeah, my mom started getting a little upset, and I eventually got to, I think it was Innova Hospital, got submitted, and they're like, yeah, you have type 1 diabetes. I'm like, what is that? And they're like, yeah, it's a lifelong condition. And then, yeah, that's when I broke down. Instinctively, the first thing I wanted to know more about with Raylene was my standard deviation of 9 numbers. Summarize what that is. It's the variation of the highs and the lows. So I wanted to decrease the distance between the average amount of highs and the average amount of lows. So ideally, I'd be right in range, which would decrease the standard deviation. So that was the biggest thing, because if I could decrease that, everything else fixes itself. So if I focus specifically on that, I don't need to focus on anything else. There are a lot of things that I didn't previously know about, like how depending on how much activity you do and how rigorous it is, it can affect you up to 8 hours after you actually do that activity. So there were unexplained lows that were occurring during the night, and it was because I was having late night tennis practice around 7 or 8 p.m. I couldn't even wrap my head around that because I had never experienced that before. So to fix that, basically just had to set an even harsher temp basal, basically set it to 90% less, because I'll never set it to 0%, because then the pod starts messing up, because then there's no insulin going into the body, which causes the fight to fly. I think the first thing I would tell myself back then is just to not stress too much about it. Like if you mess up once or twice or even 8 times in a row, don't take it too personally, because especially in the beginning, I mean, with that honeymoon period, that messes everything up. Your body's still trying to produce a little bit of insulin, but it's not quite doing that. So then the insulin you're trying to give doesn't work this day, but it works the next day, and it just gets all mixed up. You can make substantial changes every week. And then depending on what you're currently doing, like if I'm at home or if I'm at school, the basal rates can completely change. A lot of it with the basal too. If I know I'm going to be doing an activity 3 hours after I begin eating, I should probably still give less, because there could be insulin on board that could be affecting my levels later when I do the activity. That's the biggest thing, the insulin on board. That is something I really haven't taken too much interest into, but thanks to Raylene, I now make sure to check it every time I go do a workout or go play tennis or go on a hike. That's a really big deal. That determines whether or not I have a nice day or an ice cream day. When we look at our numbers, I mean, there's been so many decisions I make every day, but it just doesn't even stay in my short or long-term memory. I have to go and check. Sometimes I'll make little notes in an online note-taking app. This is one of my worst weeks ever, but it also is a testament as to how my tennis was being managed at the time, since I was actually pretty new to the Dexcom here. Yeah, this is kind of atrocious. This is the beginning of when I met with Raylene. And then over 90 days, we have come to manage something that looks like this. This is one of the best weeks I think I've ever had, barring this one high at night and this one high during the evening. This is the change that Cecelia Health can do to an individual.